Yes.
Just to discuss some things and sort out a few things and talk about some post-op surgeries, etc. And kind of hear you guys' opinion.
UK coming back to scene again after a long time.
Exactly, and
people must be dying to know how you got here.
I can't say. I got here anyway. I'm here. So I can't say how I got here.
Yes,
I got here.
You got here, exactly.
Quantum physics.
Huh?
Quantum physics.
Exactly.
Quantum physics.
But yeah, guys, do you wanna, tell people what they're here today? What you're here to discuss
Exactly. I mean, with the opportunity having you here, and you are known, really well known in UK, in fact in the world, about as someone knows about the surgeries and openly talks about the surgeries. And as Clinichub, as you know, we have been performing surgeries for years and years and years. And UK and France, Germany, Netherlands, Belgium, Switzerland, USA is our markets and growing daily. We are serving already over 3,000 people a year. And I'm proud to say that our partner surgeons, Dr. Furkan, Dr. Doğuş, Dr. Yusuf on the ethnic rhinoplasty especially, and rhinoplasty, Dr. Burak are, how can I put it politely, they are actually the most famous surgeons in Turkey in my opinion, and in Europe and in the world. So they are already booked for near enough half of the year. In fact, actually, the camera is on Dr. Yusuf. He is fully booked already 2021. So we want to talk about the surgeries because people are interested in surgeries. We want to answer questions about the pre-operation, assessment, post-operation, aftercare, post-operation follow-up when they go back to their own country, because we've got questions coming to us, and of course I know from you that you've been communicating with me, people even asking you, so all of those we want to discuss. Each of us are very enthusiastic about our profession. Our surgeons, our partners, they love what they do. So they love teaching people what they do and explaining the surgeries. So that's how we want to start. We took the time on Sunday to tell you about what we do, facilitating international patients in Istanbul with the utmost care. And the surgeons are going to tell you each surgery they perform and what happens, what can happen, all of those. So it's just a Sunday chit chat really. Having you here is a great motivation to talk about these things to the people, because you are known about the surgeries. So yeah.
So first of all, I want to welcome you to Istanbul.
Third home. So why second?
I know. Yes.
Third.
So you love Istanbul as we do, because we are lucky to be here in the center of the world. And Istanbul is a great city, as you know, and we love the city. And within this city, we love people. We love to welcome people from all over the world for having. Our profession is cosmetic surgeries, and for having cosmetic surgery procedures done, because this is not something to be ashamed of. You want a better version of yourself. Everybody wants a better version of themselves, and we offer this here for you. First of all, I want to express something about the surgeries that you are having. We always use international accredited hospital facilities for all of our operations. Because of this situation, you are safe here. We are not doing anything, any surgical procedure in the clinics or in the for example, unregistered places or in the floors. We always do our procedures in the operation rooms, near ICU units, and near every possible scenarios to be taken care of. And after you are discharged from hospital, you will be taken to our post-op care hotels, which we provide medical care 24 hours a day. For example, we have our own post-operative care doctor and we have our own post-operative care nurses available in the hotel, so you are not alone here. The most important thing for my point of view, if I go some country and have a cosmetic procedure done, I don't want to be alone, forgotten in the hotel room, to be waiting to be recovered. So this is not a thing that we do. Even more, in our clinic, we hire our own post-operative care nurses within the staff of the hospital and taking extra care of you. Because especially in these days, most of the people cannot come with a company to have surgery done. They often come alone, and we don't want to leave people alone. And after you are discharged and after you are going your home, we are always available for you. For example, if you may have some questions, you may forget what we told you. At least you may want to ask more questions. You may have a problem, because surgery is always a risk. We cannot say everything will be 100% smooth and guaranteed. We always try to tell this. And we never let anyone unanswered, or we solved everything
alone. As long as they want to communicate with
we
us.
solved everything somehow. We offered revisional surgeries. We offered everything for the people who want to take the way with us. So I think this is the most important and ethical way to deal with some problem, and by this way, all I am trying to tell is our friends here, surgeons, nurses, coordinators, even drivers, everybody, we are serving you as a team here. This is not a factory, this is a service, I think.
There's over 50
Yes.
people right now in Clinichub,
And
waiting
all of
to.
these people
Yeah.
are, as you said, very enthusiastic about serving you, because we don't let the opposite.
Exactly. So
That's what I'm trying to say.
we will go into surgeries in more. Just to introduce the surgeons here, actually, Dr. Doğuş is there, so I'm sure he has got few things to talk about generally, and then we'll go into surgery first, because people are really curious about the BBL. Even though we do a lot of operations, they see it daily, so they still have questions. What is a BBL? Can I have a BBL? And all sorts of things. For example, breast reductions, liposuction, mummy makeovers, facial surgeries, rhinoplasty surgeries, cat eye surgery. So people have breast augmentation, especially now summer coming. We are receiving daily hundreds of questions from all over the world. So all of these we will talk about, but generally Dr. Doğuş now I think is going to say a few words, and Dr. Burak is going to say a few words just to tell everyone how much we start, follow and complete from beginning to the end.
I think before we go into that, I think let's just address the elephant before we move on to the surgery stuff. Because I think that is just normal, that we're going to,
Yes.
normal question. I think obviously because you said, I've had a few questions from people who
Yes.
have had issues. Very minor, a handful, not many, who have had their issues with Clinichub. And I think this is because obviously you haven't spoken on it in the past.
Yes.
We had, obviously the BBC made a documentary, and
Yes.
when we spoke yesterday, you did say that they only gave you 3 minutes, and there's so much to discuss in 3 minutes. And I can understand, with that being said, you can only discuss so much and compile it into one section. But I think now would be the best time, the best opportunity, outside of the legal stuff, because you can't discuss the legal stuff, just to kind of address those who have felt like they haven't been given the best, and I feel like as a clinic, because obviously regardless, if a customer comes and they say they're not happy, we have to take responsibility for that, because we are a clinic and
Which
we work.
we do, but we need to explain better.
Yeah, but it's better for you to explain. You understand? Because I get messages. I'm sure you guys get messages when something's not quite right and they're not quite happy and they feel like they're not being heard. And I feel like above all, being heard is the most important thing. And being, knowing that if I've come here and I've come here for a service, even if, like you said, put it so rightly, Dr. Furkan, that sometimes things don't go 100%. Do you understand? And that's all surgery, even not cosmetic surgery, normal surgery. You go do something, sometimes for health even reasons, it may not always go the way you planned. But people need to know at home, that at home that at the end of the day, if something has gone wrong, what do you guys do as a clinic to support them? What can be done, and if you feel like maybe in the past things haven't been done the way it should have been done, if there's an apology that needs to be issued.
I think I'll speak about this because that's the reason I was very keen to
have
talk
me over.
with you.
Yeah, have me over.
Because
very for this situation.
Because you're very direct, and actually you're very
I'm quite straightforward.
And we respect people's questions. We respect, in fact, actually. First of all, let me tell you, apology is always my, first thing to come to me. If I ever, as a person or as a company representing the company, upsetted anyone, I can categorically, from bottom of my heart, 1 second.
No.
Oh, okay. So it's still on? Yeah. Okay. I can categorically say if I upsetted someone on a personal level, I can categorically say that, I am sorry. However, coming back to your question, complications happen. I just mentioned to you maybe 5-10 minutes ago. We are the most busiest clinic, proud to say, in Istanbul, maybe in Europe. We are serving over 3,000 people a year. Okay, and unfortunately, very few percent, 1, 2, 3, ended up with the complications. And that, I feel, okay, if we are short in, or if the customers felt that we were short in replying or helping them out, actually, as a post-care. But I also want to mention that we are always there. Okay, it is our part of the service. It's not just the surgery only, it's also the post-care. Okay, but if one person, Esther, decides to talk to the social media, not to the surgeon who has done the operation, and not to the clinic who has helped them come and be a facilitating of this service, but rather try to gain a sympathy over an Instagram and Instagram followers, and decide not to get engaged in communication with us. Okay, we cannot help people. So we are always ready to communicate. We are always ready to take them back. We are always ready to answer and, if necessary, redo the operation, and without any cost to them even. But we need communication also from customer part to us. Okay, we cannot communicate to ourselves. We need to understand what they are going through. We are putting a solution forward. They need to read the solution, or at least agree, not communicate with us.
I'm so sorry. Yes, I was just trying to.
Don't go live with them, just go live on my one. Okay. That's a mistake. Go live with him. Pass it.
Wait, I closed the thing. No, it's live already.
No, but you're going live with him.
Yeah, sorry. We're gonna do it together like this.
You need to go live independently by yourself. You're joining the live with him.
It's good, it's good.
No, this is not. You're not supposed to do it like that. Just go live.
We were live normally, but we wanted to split them together, So
okay.
So just to wrap it up, okay, we are, first of all, if anyone felt upset, anyone felt unanswered, I categorically say I am, apologizing for the way that they felt, and I will be available, my company will be available, all of us will be available to fix anything and everything, because the people who had small minority, very small number of people who had complications, they trusted us and the surgeons to do the surgeries. They should trust us again to
fix it.
to fix it. This is all we want from people.
So those that have come and said that they have had issues, can they contact you guys now? And
We would love to talk to them,
Okay,
but
that's fine.
what I feel, Esther,
Yeah.
people rather talk to Instagram and try to gain followers on Instagram rather than concentrating on the issues. Okay, so speak with us. We will help. Of course, we will help.
Okay, that's fine. It wouldn't be right for me because obviously I have to speak for my community and where I come from,
course.
and it wouldn't be right for me to come
I would,
and
I'm sorry.
yeah.
Can I add something?
Come.
Very, very brief. In my opinion, what Ibrahim say, Mr. Ibrahim say, is exactly right in our point of view. Of course, keep in touch with us, keep in contact with us. You can always feedback on social media, feedback on conventional media, because people has the right to learn about things. We are not in the opposite direction of that. But as surgeons and as clinics, as medical professionals, and as a family of big family of friends, we always want to make you feel that you can always contact with us, even if you had a bad experience, even if you had a bad communication. Communication is between two sides, and one side, we are always ready when you are ready. That's something I wanted to say. Of course, I don't want people to misunderstand things, right? I had a bad experience with Clinichub. I had bad communication. Now I am on social media. Now I cannot go back and talk to them again. No, even if you have said something bad about us, we are professionals and we understand your psychology. As surgeons, we are experienced in that. As a clinic, we are experienced in managing these kind of complications psychologically, physically, and surgically. So we always have an open door for you. I just wanted to say that in addition.
Thank you very much.
And this is not a secret. Dr. Burak is here.
Dr. Burak
I
is
am
here.
here, Dr. Hoş, and Dr. Yusuf. We have one surgeon. He is out of the town here. Also, Dr. Emrah, our rhinoplasty surgeon, the other rhinoplasty surgeon. And also, we will announce new partner surgeons in the near future for you to answer all of the inquiries that we are having. I want to say this is not a secret. I did lots of revision of my cases. If I see something wrong, after having a good communication, we called them back here and fixed this. And this is not a secret, and we do it all the time.
However, I must say that
We are going to
it is
do it in the
about,
future.
very minimal. 3%, 2%. In the surgery world, the complication rate by the books is about 10%. We are less than that. We are about 2 to 3%, okay? Which is unseen, unheard of. But unfortunately, it does happen. So, but we are there, and we will be talking to anyone with open arms.
Yeah.
And if there are upset people in the past with this opportunity today, I want to invite them back to say hello. We want to say hello to you, you know?
Speak to them.
Exactly,
Fine,
speak
yeah.
to you, speak to me, there is now over 50 people in the team, okay, waiting and dying to serve the
Bear
customers.
in mind, just to acknowledge that we started off with only 3.
That's it.
But yeah, 3 of you guys.
Three of
You know
us.
what I mean? So Clinichub has, I've been a part for how many years has it been now? 3 years now. So yeah, so it's been a journey, and I've seen the clinic evolve. But you know, and I feel like I'm quite happy that today it wouldn't be right that I have all of you here and we don't address it.
Exactly.
So I'm very happy that you guys are able, and I'm really happy that you kind of also have opened the doors for people to come in and discuss it. And I like the fact that you were quite honest in saying that you have had to make revisions in the past. You know, and one thing that, you know, especially where I come from, we like honesty, and communication is very key. Like, it's so key. And what it is that I'm quite, because I've understood the surgery world since 2016 and had to research and understand it. And a lot of people don't do their, research. And I've understood that there's always a risk. Do you understand? And I'm not going to put blame on any side, because you can't really point blame on anybody.
Also,
but it's just about making sure that I know if there's something that goes wrong, I'm able to communicate, and I'm able to know that you guys have my back and you guys are happy to help. And that's what I feel
Esther,
like.
I want to ask you, everyone knows you as an influencer
Yeah.
in your own community, and you're probably one of the first ones to
Yeah.
be,
Come
you know,
out, yeah,
come out and
yeah,
become
yeah.
an influencer. Would you, as an influencer, follow an influencer to do a surgery?
No, I again, because I know those.
This is very important because in
I
the
think-
BBC interview, what the interview was about, okay, the people who follow the influencers are basically they are, you know, someone brainless, they don't know what they want, but they only follow the influencer. Is
Okay,
that,
no,
can this be the case?
What you see with me, I'm a different kettle of fish in the sense that
Yes.
I've always been someone that when it comes to surgery, I don't just promote. Do you understand? I believe in discussing, speaking to, you know, if someone asks me, I am happy to discuss it. I'm happy to talk about it, talk about who my surgeon was, talk about what I went through. But at the same time, I also want to know the mental state of mind of the person that's asking. Because a lot of people don't do their own research. A lot of people don't do their own investigations, understand who the doctor is, are they board certified. There's so much more in research that you need to do into cosmetic surgery. So for me personally, no, I did my own research. You know, I did my own, I had to gain my own knowledge and understanding of it outside of the information that you gather from surgeons directly, you know, and I feel like a lot of people need to do that independently. You know, you can't just say because someone went somewhere, I'm going to go there. And that's why, even when people message me till today, oh, where did you go? I will explain to them, I went here, but what do you want to do? I make it a conversation. I don't just freely, because I want to understand their mental state of mind as well. Because it's also about, have you done your own research? You know, are you ready for surgery? Because a lot of people think it's just physical. It's also mental. You also go through it's a mental process. It's a physical process change. You understand? So I believe in doing your own research. I think it's quite, you have to do your own, like, it's quite, what's the word I want to use? It'd be quite irresponsible for me to just follow someone else based on what they say, you know, because that, you know, but anything can happen. So I think it is, I feel like as influencers, yes, you can give out information and say this is where I've been and this is what I've done. But at the same time, you as an influencer have the responsibility to tell that person, you know, do your own research, make sure you know he's good for you, because a surgeon that I may choose may not be a good surgeon for yourself, for example. Do you understand?
Yeah.
Not every patient is not. Do you get what I'm saying? Like, I might go with Dr. Do, for example, but Dr. Furkan might be better for somebody else. Do you understand? So you have to do your own independent research and know what doctor is best for you. And that's what I do advise.
With this now, I want to move on to, okay, the key is for the customer is researching.
Research.
Okay, thank you so much.
Yeah,
Now,
researching, yeah.
the customer research us. Dr. Burak should explain how he accepts a customer, because
Yeah.
before we choose the customer, there is a medical process the customer we put through, okay? And each of them are going to explain to you how they choose the customers. Not everyone is suitable. You are absolutely perfectly right.
Yeah.
Not everyone suitable body-wise, BMI-wise, but also mental-wise. So please, Dr. Our partner, Dr. Burak Arslan, can tell how he is choosing the customers, assessing the medical forms and the pictures and the videos.
Yeah.
Again, of course, before that, I would like to add
Many things.
a couple of things before explaining everything. So, I had the pleasure of working with Clinichub for the last 2 years, and also I had the pleasure of observing them, how they evolve and how they increase their capacity of handling all those patients. And I like to tell you that there are a couple of things only Clinichub can do by listening all the criticism, because they are so open to listen and accept that criticism, because it is the only way that they can get better, and they are fully aware of that. And in order to make the patients feel the presence of Clinichub, especially in the hospital, in the post-care period, now a nurse of Clinichub is staying in the hospital in the night shift after the surgeries, apart from the hospital staff. I think that's something only Clinichub is doing at the moment. And that creates an enormous comfort for the patient and also for me, for the surgeon. And there are hospital staff in the hospital taking care of our patients. And also Clinichub is providing a nurse just for our patients in the operations night. And also in the post-operative period, when our patients get back to their home countries, now we have a really capable, a really nice post-operative doctor, Dr. Ahmed, and he's paying enormous attention in the post-operative care. When our patients of course, they have complaints, they are getting in touch with Ahmed immediately, and Ahmed is quite responsive actually. Within minutes he's getting back. So increasing that communication capacity is, by definition, is great, I think. And I think no one has done this before apart from Clinichub. So I like that. I think no one mentioned that during that session. So I want a raise, Mr. Ibrahim.
Thank you. So, choosing a customer.
Okay, choosing the customer. So Clinichub provided, constructed a system for that, and they're trying to make everything is more efficient. And of course, they're asking from our patients to fill a medical form, and they're asking for their pictures, and of course their BMI and all necessary medical information, and they're consulting us with that. And we have a strict limitation, as all of you are aware that these surgeries, the body reshaping surgeries, are by nature so-called risky procedures. So you need to be really meticulous and really selective in terms of choosing our patients. So staying within the safe ranges, safe limits, we are picking our patients, and if the patient is not suitable, we are doing our recommendations such as losing the weight, or getting a doctor appointment, getting a clearance from a patient, from the doctor. And after that, we are trying to minimize all possible risks before the surgery. So basically, this is how it works. So is there anything else?
I think on to the questions, a lot of questions about body shaping, but Dr. Yusuf also should talk about the rhinoplasty, which has been a boom in demand, especially the ethnic rhinoplasty. I am delighted to announce that how many slots left in 2021?
Only, I think fully booked.
Already fully booked?
Yeah, already fully booked, yes.
So,
yeah.
This is only through the high quality results. So, just to say and introduce yourself again and to the world. And tell them that we are answering the questions because everybody wants to have an operation, but there's no slot in 2021. So,
Yes, unfortunately, we have fully booked until 2022. But our team try to help you. If you write us, if you text us, we have a cancellation list, and we try to make appointments in 2021. I want to add something with your conversations. We use well-known and well-experienced hospitals in Istanbul. Also, we try to choose well-experienced anesthesia team. It's very important for us. It will not it is a first quality hospital. We try to choose best hospital. It's very important for me. I am ENT surgeon. I try to fix your breath. I try to fix your aesthetical shape, nose anatomy. But your skin response, your body response is very important. Before the surgery, we try to discuss how it will go, how I can do with your nose. Yes, if you have any question, I can reply about rhinoplasty.
I think everybody wants to know. Now, Esther, is there anything else that you want to discuss about these things? Because this was it was very important for you and for us to openly say that we are ready to answer anything.
Yeah, so far, I feel like you've answered. Obviously, we can't talk on other stuff, but in terms of knowing that the door is open for those who have felt like they, they're not very happy. I'm very happy to hear that, you guys are going to listen and take them in, because I have got some messages already. So, but that's it really. I think we've got a few questions. I did speak to one of our working partners, which is Felicia's company.
In London.
Yeah, she does.
Alaya Aesthetics in London.
Alaya Aesthetics, who does.
She has been a great support in providing actually post-care.
Post-care,
to returning patients.
Yeah.
And the surgeons can now talk about the liposuction and the BBL, and then I think
Yeah.
her customers and many people are asking also the importance of massages.
Yeah, so that's
After the liposuction and after the BBL, and especially after the tummy tuck and liposuction, are massages important? And all of those questions people want to know. So I think the plastic surgeons, they should now take over and talk about the surgeries.
Yeah, I wanna just say as well.
Yeah.
But when I spoke
Esther is saying something.
Yeah, when Felicia, I spoke to Felicia upstairs, and basically what she was saying in terms of massage wise is that she feels that we need to encourage a lot of people after they do surgery to make sure that they get the right post-op care, in the sense that not in terms of once surgery is done, because I always say 40% is surgery, 60% is the process of healing and making sure you get your right massages, etc. Getting drained properly if you need to be drained. And she's found that a lot of people keep going to the wrong, are not getting or don't know of the right post-op care to go to. So as doctors, what do you guys do? You guys give recommendations, or is there what do you advise your clients after having cosmetic surgery, especially when it comes to liposuction? What recommendations do you give your clients? Because I feel like when people get back to the UK after being here for etc. a certain period of time, they're only just trying to find anywhere just to get a massage. And I think we need to kind of discuss the importance of getting the right massages, the right post care, and that's why let you guys take it from there.
Yeah. Take over those.
Okay. As Esther told you, surgery has a certain importance, but post-operative care is really important. So medically, first of all, you will have some pills to take. But starting in your hotel stay, we have a very experienced nurse team, and they are going to be taking care of you. So even in the first days after your surgery, you will get an idea, you will have an experience of how your post-operative care should be. There are two things basically, the massage and the compression garments. We will be providing both of them for you. Before you leave for your country, before 1 or 2 days, you will have a visit to your surgeon. And the surgeon will control everything depending on your body type and your own limitations, own characteristics of your body. He's going to explain how many massages, minimally and ideally, you should be doing by yourself or by professionals. And it's the same for the compression garments. The surgeon will tell you how long you should use it, minimally, ideally, what are the exceptions. Also, apart from that, we will be advising you when to go to the gym, when to drive, should you have a company with you, when to have sex. We will be talking everything. This is the kitchen after the surgery. So the answer to the question is, we will be answering everything, and we will be keeping it as a secret, okay? But we always have guidelines. We don't finish this journey in the control appointment. Until you get on the plane, there will be someone with you. You can ask always. I do voice recordings. I take notes. We are giving you guidelines. Is this the end? No. When you go back to your country, you can always reach us. We have a post-op care team, and Dr. Ahmed will be answering all the questions. And I know, as surgeons, even if we are busy, very busy, we will be answering directly as much as we can through the social media. But the team, the post-op care team, even if you don't ask us questions, we'll be reaching out to you, ask for your photos, and ask you how you've been taking care of yourself. I know most of the girls, day by day, by time, has developed in terms of post-op also. But Clinichub is going to a better space, better place. Also, the patients coming now has a more sense of how important the post-op care should be. Yeah. So, and there are two things I want to mention here. The first thing is that how am I going to do it? Is it going to be painful? Yes, at first it's going to be painful, but no pain, no gain. The second thing is the financial issues. I know you have been spending a lot of money on surgery and on your journey. I'm pretty sure Clinichub can make some campaigns and discounts for you. But after that, you will be spending money on some massages and post-op care creams and compression garments. But this is a good thing for you. So don't go to unexperienced people or cheap ones.
Yes.
Can I ask a question?
The last one,
Okay,
I'm going to
let's
sell it. And then you will be spending money on clothes. That's the best part. You will need a new wardrobe, okay? Please, Esther.
Yeah, I want to ask that because I feel like as doctors, this is for all of you guys to answer. It needs to be very clear. Post-op care, how long do you guys recommend that with people, clients go for massages, clients wear their garment? Because I've noticed that now a lot of people that go and do surgery, once they've got their surgery and they see their body and they're happy, they feel a month or two later, they feel like they've healed. We all know that's not how it works. We all know that internally, there's a lot of healing that needs to be done internally. Yes. You know, there's still, the nerves need to reconnect, etc., especially when you do lipo, the fluid. So how long as doctors do you recommend that clients wear their compression garment for and go for massages, and how many massages per week? Because Felicia did recommend that they shouldn't go more than 3 massages a week. I mean, they shouldn't go more than 3. This is, I think, after a period of time. It shouldn't be more than 3 a week because you don't want to overstimulate the body. Apparently, I don't know. You guys can give us your opinion. And that also, for example, when I did my surgery, I wore my garment for for the first year, every day for about 9 months, even almost a year. Then about the second year, I was on and off. But I would say about 2 years I wore my garment for. I was very, you know, dedicated because I knew the results I wanted. So I want to know from you guys' opinion, how long do you recommend that clients wear their garment for, and how long should they continue on with massages?
Okay,
First of all, I want to express that everybody is different. Okay. Even if they look the same and we do the same operation, we take out the same amount of fat with the same amount of time, within the same amount of time, they may heal different. That is very dependable. But generally, if we want to talk generally, I suggest our patients to use their post-operative garments for an ideal time of 2 months. If you can tolerate, you can use more, of course, but 2 months is a must. And you can check the amount of swelling that you lasted, the softness of the tissue. Sometimes there are so much swelling and the tissues are very hard. But some people heals very fast and very smooth.
So are you saying 2 months, like 24/7, 2 months straight?
Yeah, sometimes if you wanna wash it,
take a break,
and take a massage, take a shower, it's okay. But not more than a couple of hours because you may be swollen again. Okay. Especially in some patients, they are more sensitive. They swell more. And besides of that, for the massages, I find massages very useful and very helpful for healing. We do aggressive liposuction. We don't do very little soft lipo. That's not our thing here. And with aggressive liposuction, of course, within the fat, the lymphatic system, the nerve tissues, the vascular system, they will also be affected from the surgery with some amount, with certain amount. And to help the body to take out these swellings, massages are very useful. They accumulate the fluids to the lymphatic system of the body. Okay. And within that, but we do not suggest our patients open drainage. If it is needed, we do it ourselves. I don't like my patients to be open their stitches in the massage rooms and draining the fluids.
Even in Istanbul now, we hear a lot of people popped up.
Do you know, that's what Felicia
claiming they are performing aftercare and actually exploiting people's vulnerability, you know, charging them extra money, and also even trying to sell them garments and so on and so forth. Look, our packages are all inclusive. You do not need to pay extra things.
That's what let's just stick to the Felicia thing, because I agree with that. You know, when it comes to the post-op and opening the drainage, opening the stitches, I think that's quite good that you've touched on that, because it is quite dangerous. Because Felicia said that she's had a lot of customers who have come, not just from Clinichub, around the world, who come and get post-op care, and that she's noticed that they're reopening their incisions, and obviously just explaining how dangerous that is, because it's not, you shouldn't reopen an
It is
incision.
not sterile. First of all, the environment is not sterile, and you may end up with infection. And also, in our clinic, we use closed, sterile draining system for a couple of days after surgery. So you don't go your home with seromas inside. Even if you have seroma, we empty them before you go back. And within this closed system, everywhere is not wet after surgery. I know some surgeons, everybody has different styles. They don't stitch the wound, they leave them open, and you sleep on a bed soaked with body fluids. But this is not our thing here. We always closed all of the incisions, but we used closed system, sterile drainage for a couple of days after surgery. And with the advantage of having post-operative care nurses in the hotel, they can take care of your drainage system. And we are comfortable with that.
Yeah.
So I don't suggest any of my patients to have them stitches reopened in the massage rooms and getting the drainage thing, because you don't need it.
Okay, you've heard that, guys, because that was something that was a topic. Another thing I wanted to ask, because I had a lot of people ask me this, is that in terms of, do you guys recommend a full mummy makeover? So breast, BBL, tummy tuck. Do you think that is right to do all at once, or do you recommend that it's all done separately? No, it's a good question, because someone did ask me that if you do things like that, how am I supposed to sit? How am I supposed to heal? Because I always believe, I did mine separate. I never did everything at once, because I feel like, how am I going to sit down or how am I going to lie down if my breast is done? So I feel like, in your opinion as doctors, do you recommend it?
I think Dr. Brock can take the lead here and answer the question.
About combination surgeries.
Again, all surgeons are having different opinions about that matter. And in terms of the result of the BBL, I think it is most ideal to do the BBL as a standalone procedure. But okay, we are performing mummy makeovers quite often. 2-3 times in a week actually. So we usually perform them together, and it is. I must confess that combining the surgeries are having difficulties in terms of protecting the result of the BBL, because, as you know, after the surgery for your BBL, you need to protect your bum and your hips at least 2 months after the surgery. You should not apply any pressure. So, but we are also aware that most of our patients are not having the chance of visiting us again 6 months later for another surgery. So they want everything in one session. In those cases, we are combining the surgeries and we are doing BBL and we are injecting fat a little more than usual. So we are beforehand assuming that there will be some fat loss. That's where the BBL becomes more than bigger. But as again, to briefly sum up, doing the BBL as a standalone procedure is the most ideal one. But it is not dangerous, or it is not, unusual to perform a mummy makeover and combine those surgeries together.
Great. That's all. Okay, there are, of course, we discussed about the rhinoplasty, and now cat eye surgery or almond eye surgery is on very much demand. Very much on demand right now, and we are ready to answer any questions about that. Rhinoplasty is a hot topic again, especially the ethnic rhinoplasty is a hot topic again with us, with Clinichub. And I also want to tell you, guys, we are receiving daily minimum about 1,000 new inquiries, and we are 11 sales coordinators trying to answer them. Again, if we are short in time answering you, because we have shifts, we work in shifts, And if you're, if you're waiting an answer on those, we are always constantly trying to be online. We are always trying to reply to you. But yes, some of the messages we get, I haven't received a reply a couple of hours, and I haven't received a reply 20 minutes. But we will reply. Just bear with us. We are delighted every single day. 1,000 new customers from around the world is writing to us. Clinichub is massive in UK, is growing massive in France, Netherlands, Germany, Switzerland, USA. So this is happening with you because you have been trusting us and you have been working with us. You have been fantastic customers for us for the last 5 years, and we promise you we will make it better and better and grow better and bigger for you to serve you. So please keep asking us questions about anything, about rhinoplasty, about cat eye, about BBL, about mummy makeover, about the campaigns we run. For example, we have breast augmentation campaigns we are running at the moment. So anything that comes to your mind about the surgery, pre-operation, post-operation, aftercare, post-op follow-up, we will be ready, even more ready to answer and make your journey one fantastic, amazing experience. This is our promise. Anything else you want to add, Esther, since you're here?
Yeah, I think it's I think you've kind of said it all. I think I've got so many other questions that people want to ask, but we've got such a short time that we can't answer it all. But again, I do want to make clear, if anyone has had any issues in the past and they feel like they haven't, been heard, please feel free to come in. Contact us, contact Clinichub directly, and I'm sure they're going to be happy to help. Not sure, they're going to be happy to help. And I think as well, as individuals, if you do decide to do cosmetic surgery, doing your own independent research, and I always believe in not having a wish pick, because I feel like wish picks, we all have different bodies, and it's best for the doctor to give you the best advice in terms of what is best for your body shape. What else do I want to say? I think, I think because we've got only such a short period of time, I can't answer everything. I'm happy that we've kind of been able to address a few things that have been quite limbering and had a few issues with. And
Yes, it is very important to apologize.
Yeah, I think it's very important.
If there are people who are upset
yeah,
and felt that we have not been able to answer or reply to them, I say we will be better in communicating, and if we have upset them in a way, I sincerely apologize for the way they feel upset, and we will fix it. There is nothing that we have not fixed. We will communicate.
Like Mevlana. Huh?
Exactly. Come, whoever you are, isn't it? That's the actual motto of Turkey.
yeah. I think as well, someone just asked as well, just a quick one, that how in terms of the language barrier, obviously because we've got a lot of people coming from different parts of the world, and sometimes they feel, as you can see, the doctors are quite good at speaking English, but I think they were saying that the nurses, sometimes they find it, like the massages, that sometimes there might be a language barrier. So in terms of what do you recommend if you feel like there is a language barrier, or someone's having issues with communicating with the nurse that's doing their massages, etc., what would you advise the customer or the client that's here at the time?
To be honest, our staff, not all of them speaks perfect English, and also even as surgeons, we don't speak, for example, perfect French. But we have wonderful translators, and but the nurses also, they speak basic English. No, you will see it. You will see it with this experience this time, and you can have the communication, no problem with that. And we have lots of.
Might close the session, so we can say nicely.
Yeah, goodbye. We are going to say goodbye, but the language barrier is not a big problem now.
We have a chart.
Yes.
Oh,
Basic things.
say that again?
Every patient has a chart that I have pain, I need this. So in Turkish and English, so you can just show.
Okay.
Just show to the nurse, even if she cannot speak any English. There's a chart. Also, there are translators in the hospitals, like Memorial or the other hospitals. Also, Clinichub translators. Also, their coordinators can speak, so they can reach out to them. So I'm cutting. Peace out.
Yeah. Well, any questions, please feel free to message Clinichub or myself if you feel like I wasn't able to answer all your questions, and I will get back to you.
Thank you.
Thank you very much, Esther. I love you.
Love you too.